Hello, I want to speak to you today about a disease that affects millions of young people. As a matter of fact, asthma is the most common chronic disease globally and affects over 300 million people worldwide. It can present at any age, and twice as many males as females are affected by this disease. Asthma is associated with the specific chronic inflammation of the mucosa or lining of the lower airways. One of the main goals of treatment is to reduce this inflammation. When the lining becomes inflamed, this can result in swelling and excess production of mucus in the airways, leading to a feeling of not being able to catch your breath. So, what is asthma? Well, it is a chronic respiratory illness that affects people of all ages and results in a narrowing of the airways, leading to shortness of breath, wheezing, coughing, tightness of the chest, or pain. And these symptoms can be mild or severe and be made worse by if you have a cold or perhaps the flu. The photo depicts what a normal airway looks like and what an airway looks like during an asthma attack. As you can see, a normal airway is open sort of like a water hose and the air will flow through easily. But an inflamed airway is very narrow and swollen, difficult to catch a breath through there. So that's how you would know. So what causes asthma? Well, the actual cause is unknown. However, attacks have been linked to many allergens such as pets, cigarette smoke, cold air, and perhaps dust mites. It's important to know what your triggers are when you have an asthma attack. Everyone is different and everyone has a different trigger. If you suffer from any of the known symptoms, it's very important to know and try to avoid these triggers. Cigarette smoke is a big one. It's very irritating to the bronchioles and can result in a severe attack. Even secondhand smoke, whether you smoke or not, it's important to avoid cigarette smoke at all costs, especially if you have asthma. Common treatments for asthma include rescue inhalers and maintenance inhalers. While rescue inhalers are important, it's important to not let your asthma symptoms get to the point where you need to be rescued. Long-term medications work in the background quietly to control airway inflammation without you actually even feeling the immediate effects. So their benefits might go unnoticed and lead people to stop taking their medicine. But not taking long-term control medications when needed can be dangerous and even fatal. If this becomes a concern, discuss it with your parents and your physician immediately. There are many treatment options for asthma that lead to controlling the symptoms. Adrenergics or beta-2 agonists are usually in inhaler form, such as albuterol, and helps to regulate your body's reaction to stress or an emergency. Steroids help reduce inflammation. Theophylline typically works by widening the airways in the lungs and by strengthening the diaphragm. Hydration is also important because mild dehydration is common in acute flare-ups of asthma. If the attack is severe enough, a mask might be necessary for receiving temporary oxygen therapy. Finally, anticholinergics are sometimes used with caution because of the risk of adverse reaction and negative side effects such as dry mouth, headaches or nausea, or a more severe reaction which could lead to mental confusion. So if that's happening, you need to let your doctor know that and he may want to not have you use that medication any longer. Another option when you have asthma is the importance of monitoring and the use of a peak and flow device. Monitoring peak and flow allows you to know what zones you're in. It is an important tool used to determine what your personal best is in order to know when adjustments need to be made to treatments. If you have asthma and you don't have access to a peak and flow, it's important to ask your physician. This is a valuable tool that can keep you from getting into trouble with your breathing. The green zone means that you're breathing at 80 to 100% of your personal best. Yellow zone, if you use your peak and flow device and it hits at 50 to 80%, that's caution. You might want to increase your medications. And the red zone, less than 50% of your personal best, is danger and you could be headed towards trouble. So you need to make adjustments as necessary and possibly go to the ER. Also, it's important to talk to your parents about how you're feeling. Let them know if you're in trouble and if you think your medications are working adequately. Here's a question you might be thinking. How will I know if my medication's working? Well, If your medication's working, your symptoms will be kept in check. You won't be having the dry, hacky cough, you won't feel the shortness of breath, and you won't be having the difficulty breathing. So don't be in denial about your asthma or stop taking your medications. Just because you think this is not cool, I don't want to be sick. Your life may depend on it because asthma can and is often very serious. Thank you for your time and attention, and please feel free to take a moment to review the references for this discussion. Thank you for your time, and don't forget that you are not alone in suffering from asthma. Many are suffering right along with you. Thank you.